Welcome back. This is Consumers Doctor on the behalf of the foremost organization. Today, I want to talk to you about visionary, visionary, and original author of health, personalized healthcare, Ronald E. Bachman, President and CEO of Healthcare Visions. So let me explain to you where I'm coming from. This is just not from, my idea is just not from, you know, uh, from the sky. This is well thought out vision by Ronald E. Bachman. He's an actuarial, he's an author, teacher, and healthcare consultant. Let me go into the details. He has been in the center of US healthcare transformation, advancing free market solutions to lower the number of uninsureds, expand the mental health coverage, and promote the concept of healthcare consumerism. Healthcare consumerism. Mr. Bachman is a retired principal from PricewaterhouseCoopers, where he consulted to a broad range of clients, including employers, HMOs, hospitals, physicians, indemnity carriers, Blue Cross Blue Shield plans, as well as state and federal agencies. He is currently the president and CEO of Healthcare Visions, a thought leadership from dedicated to advancing ideas and policy initiatives that are impacting the US healthcare market. Mr. Bachman has been a senior fellow at the National Center for Policy Analysis, the Wye River Group on Health, Newt Gingrich's Center for Health Transformation, Georgia Public Policy Foundation, and an advisor to Goldman Sachs Policy Institute. Solving the uninsured problem. Over the years, Mr. Bachman has worked with, provided technical analysis to, and testified before the US Congress several times. He has been designated expert to the Center for Medicare and Medicaid Services, so called CMS, and the Congressional Budget Office, CBO, the Department of Labor, the DOL, National Institute of Mental Health, NIMH, the Substance Abuse and Mental Health Services Administration, called SAMHSA, and the members of Congress. Bachman was a technical resource during 1993-94 Clinton health reform initiatives. He provided input on mental health issues for the Affordable Care Act and has worked with US State Department, US Senate Health Committee staff on free market solutions within proposed repeal and replace legislation. Expanding mental health coverage. From mid-1990s, Mr. Bachman worked across the political aisle with the Carter Center, Senator Ted Kennedy, Senator Paul Wellstone, Speaker Newt Gingrich on mental health parity. Mr. Bachman directly testified, provided risk analysis, and performed actuarial pricing to over 30 states in support of the passage of mental health parity legislation. Mental health parity legislation. His work, his work on mental health culminated in the federal passage of 2008 Mental Health Parity and Addiction Equity Act and the Medicare Improvements for Patient and Providers Act, providing healthcare consumerism. In 2001, Mr. Bachman initiated the concept of account-based healthcare with President Bush White House, and Treasury, and introduction of 2002 health reimbursement arrangements like HRAs. He provided regulatory input in 2003 on health savings accounts. He provided input on mental health issues during 2009 to 10 development of Affordable Care Act. Mr. Bachman is currently an expert resource to the Senate Health Committee that is looking into repealing and replacing the legislation. Mr. Bachman is a graduate of Georgia State University with a master's in actuarial science. He's a 2018 inductee into Georgia State University Risk Management Hall of Fame. He has earned BS in Applied Mathematics with Georgia Tech. Ron's most recent book in 2017 is Understanding Healthcare Consumerism from 2017, which was published. Practical Strategies and Actionable Insights is the second book, Practical Strategies and Actionable Insights. A sampling his writing includes Consumer-Driven Healthcare, The Future is Now, Employer's Guide to Patient-Directed Healthcare Benefits, An Employer Guide to Pharmaceutical Benefits, A Legislator's Guide to Creating an HSA State, Lowering the Uninsured During an Economic Downturn, An American Solution to Healthcare. These are all his books, folks. These are all his books. Depression is a bottom line issue. And is also another book called Corporate Readiness for Healthcare Consumerism. Bachman has been chairman of the editorial advisory board for field of media and Institute for Healthcare Consumerism. He has been on the boards of Skyline Trail, Bryan University, Georgia Charity Care Network, and Jacob's Ladder Austin Autism Center. Folks, this is just not made up. This is the HIP, so-called Health Insurance Personalized, is based on the vision from Ronald E. Bachman. This is not my invention, folks. This is not consumers' doctor's invention. This is a true visionary on the health care which can be achieved through health insurance personalized, so-called HIP. Thank you for listening, and we will see you next time. Goodbye and salute.